Bright and colourful vaping products, as well as those with appealing flavours, could be restricted in a federal crackdown on e-cigarettes. The Federal Health Department is working on its tobacco strategy for the rest of the decade. One aspect under consideration is restricting brightly coloured products and those with flavours like bubblegum or fairy floss, due to concerns they make smoking more appealing to younger generations. It comes as a new report expands on existing concerns about vaping, that it presents a dangerous stepping stone to addiction for children and teenagers. And for more, let's bring in Professor Emily Banks now from the Australian National University. She's the lead author of this latest study and joins me now. Professor, thanks so much for your time. So your research found young people who vape are more likely to end up smoking cigarettes later in life compared to those who don't touch a vape first. But is there anything to suggest that the availability of e-cigarettes is actually attracting people who would otherwise have no interest in smoking whatsoever?
So we reviewed the global evidence on e-cigarettes, and the bottom line is they are harmful to health. And one of the harms is that young people who use e-cigarettes have around 3 times the probability of going on to become smokers compared to young people who don't use e-cigarettes. And even when we look at the studies that have adjusted very carefully for that idea that they might have already been going on to smoke, we still find that increased risk. So it really looks like it is introducing a new generation to the nicotine addiction that goes with e-cigarette use, but also to that probability that they will then go on to smoke.
There is this perception, though, that it is a healthier option to smoking. What about the difference in harm caused? A key aspect of this is whether the long-term health implications of vaping are any worse than smoking. What have you found on that?
Well, really what we're talking about is non-smokers and children who would never have gone on to smoke in the first place. So we have to be really clear that we're not comparing that with smoking. We're comparing that with neither smoking nor taking up e-cigarettes. And what we find for that group is there's increased risk of addiction, of poisoning, of lung injury, and of trauma and burns. And then once again, this increased risk of smoking. If you look at people who are smokers, then most smokers give up successfully cold turkey. That's the commonest method of giving up. For other smokers, there's also approved therapies like nicotine replacement therapy. And then Australia does have a prescription-only model for e-cigarette use. And our studies showed there's limited evidence that e-cigarettes can benefit some people to give up smoking. One of the biggest findings from our review is how much is not known about e-cigarettes. So for really common and important outcomes like cancer and cardiovascular disease, we actually don't know what e-cigarettes do. So the safety of e-cigarettes for those outcomes hasn't been established.
So what do you think we should do? I mean, on the Health Department's tobacco strategy, the suggestions of restricting colourful or tasty vaping products, I mean, would that be a fair approach?
Well, we're here to provide the evidence for the community and for decision makers. The evidence does show that those flavours are really key to young people taking up e-cigarettes. We see these products that are brightly coloured, they've got lollies on the front, there's 16,000 flavours, including, as you've said, furry floss and bubblegum. And the other thing is these small devices, they look like little USBs, they can contain as much nicotine as 10 packets of conventional cigarettes. So they're really appealing to children. They also don't have much irritation on their throat when they inhale them. So we do find that those high concentration products, which are brightly coloured and have a lot of flavours, are the kinds of products that are driving use in children. And we've seen in the US, which has really not got the same restrictions as Australia, we've seen like a quarter of high school students are using e-cigarettes. And we also see in New Zealand, about 10% of Year 10 students are vaping daily in New Zealand. So there's really a lot of evidence from overseas that if you don't have strong restrictions, you're going to get really widespread youth use.
Can I ask you as well, you're an epidemiologist by trade, about the comments from the Chief Medical Officer Paul Kelly. He's suggesting it's time Australia does away with reporting daily COVID deaths. He instead wants to focus on excess deaths, that is, how many more people are dying than what we would normally anticipate. What do you make of these comments, particularly because we are heading to winter and we generally expect things to get a bit more worse with COVID and the flu as we approach winter? What do you think about the timing here?
Well, I'm actually not, I don't work mainly on COVID, so it's difficult for me to comment. The main thing that I'm here to do is present the evidence for our regulators and people like Paul Kelly to make decisions that are good for the Australian community. I think that COVID has really shown how much we care about data and how much we need to know what's going on. So I think it's really important that the community gets that information. And I think it's really important that people like Paul Kelly are given the information that you're talking about and that the community concerns go straight through to him so that he can respond to it.
But just as an expert in the field, just your opinion on the timing around this and whether it's a good time now to stop reporting daily deaths.
Look, I really honestly can't comment. I mean, okay. I personally would like to hear about daily deaths, but I am not actually an expert on COVID. And I think it's really important also that people like me who are there to present the evidence make sure that the community gets the evidence and that our representatives, the politicians and people who are paid to work with us, the Australian Health Department, they're the ones who can present things to the community. So I can tell you my personal opinion, but I'm not an expert on COVID.
Okay, no worries. Well, it's great to talk to you anyway. ANU Professor Emily Banks, thanks so much for your time.
Thank you.